Hey, I'm Dr. Hannah Hamlin. I'm a physician with type 1 diabetes, and today we're going to talk about lipodystrophy or scar tissue at the site of a lot of insulin injections. Lipodystrophy is a common side effect of insulin injections if they've been done in the same place over and over again. And that is why, in general, we recommend rotation with insulin injections or insulin pump inset locations. According to a 2016 study, lipodystrophy actually occurs in 50% of people with type 1 diabetes. So this is a high rate of complication and definitely something to be aware of. It is easy to get into patterns where we're injecting insulin in the same place because we've got that motion on autopilot, or we always like to do it on our arms when we're in public because we don't want to pull up our shirt and inject on our stomach. There are all these reasons that we can create these habits. Or maybe we're a little bit nervous to try an injection in our leg or glute for the first time, and that's been holding us back from rotation. All of these things are common, but definitely worth considering when we look at the side effect profile of lipodystrophy. What happens is we create a lump of fat under the skin, and over time, that tissue can become insulin resistant, meaning the insulin that you inject into that area won't be as effective as insulin that you would inject into an area without. And this is important for a couple of reasons. One, we always want to get the amount of insulin we need, and so we don't want to have an absorption decrease. Two, it can be really complicated and confusing if sometimes our carb ratio works in certain parts of our body, but doesn't in another part of our body. And if we're not paying attention to that because of this buildup or that lipodystrophy, then it can make it really hard to understand what our settings need to be for blood sugar management. The other thing about fat accumulation is that it can lead to unpredictable absorption as well, which makes it even more complicated. Risk factors for lipodystrophy are not rotating our sites or our injections, using the same area of skin over and over again, and using dull needles, so reusing needles instead of using a new needle each time. What's great is there are ways to prevent and manage this. What we would generally recommend if a person is accumulating fat deposits under the skin from an area that they're constantly injecting, and we're noticing a tissue texture change, what we would say is not to use that area any longer and only use other areas of the body. Site rotation education is really important and something to talk about with your local physician if you have questions. I like to rotate my insulin to the back of my arms, both sides of my stomach, my lower back above where my pants sit, my upper glute region, both of my thighs inside and outside. And sometimes I've even experimented with giving injections in my calf if my pants don't roll up high enough. Now this is going to depend on how much fat tissue you have, because if you're very lean, you may not have enough fat there. And our intent with insulin is to inject it into the fat tissue, not directly into the muscle. There are sometimes where an intramuscular insulin injection can be recommended for people if we're looking for enhanced or quicker insulin absorption, but that's not something we would recommend doing without speaking with your physician. For me, getting into a routine where I'm rotating my sites really was something I had to script for myself, and then it became autopilot after time. It wasn't something that was hard to continue after I set it up. It was just a habit change for me. I was very lucky. I learned to rotate my insulin injections and my insulin site locations at a camp for kids with diabetes when I was a teenager. And it was really learning from these other children where they like to have their sites or do their injections and practicing the locations they use before I really got used to using all areas of my body for injections. So finding new locations, getting used to using them, making sure it's an okay place with your physician. And then the last step is just getting into the routine of chronically rotating them. Some people might want to do their breakfast injection in their arms, their lunch injection in their stomach, their dinner injection in their legs, and their long-acting insulin injection in their glutes. Some people might get into the routine of doing one side of their body one day and the other side of their body the other day. There are lots of ways to do this, and it's really just figuring out what's going to work for you at home and really paying attention to not using the same piece of skin or section of skin over and over again. The Fitter Guidelines recommends using shorter needles, 4 millimeters for insulin injections. Preventing lipodystrophy is important for optimal insulin absorption, balanced blood sugars, and not just for cosmetic reasons. The way you can keep an eye out for this is looking at the skin where you're constantly injecting to see if there are any changes that you're able to see in the skin texture or if there's any lumpiness present. I will include the resources below. If you haven't already liked this video, that would mean a whole lot to me, and subscribe to this channel if you're interested in learning more. I post content about type 1 diabetes and mindset, and I've recently released my first type 1 diabetes mindset course looking at burnout and optimizing our relationship with type 1 diabetes. Often we're taught from our endocrinologists and our primary care doctors and our diabetes educators how to manage our blood sugars, but it can be challenging to find support for looking at the emotions around type 1 diabetes. And this course is designed to help you optimize your relationship with type 1 diabetes, look at where you are, and has built-in actionable steps for helping people improve quality of life. It's a 6-module course. Each module is designed to be done weekly, so over the course of 6 weeks. It's pre-recorded and self-paced, so you can do it over your own time. Each module is led completely by me. If you have any questions about the course or any questions about lipodystrophy in general, please put them below. I'd love to continue the conversation in the comments. Thanks for sticking to the end.